The new store. This is the one-stop shop. We have a pharmacy. We have a bootlegger's liquor. The deli, the food that you can get at a lunchtime is so amazing. The coffee shop. Certain Friday mornings, there's 30 people sitting here in all these chairs. This is the hub for people to come and visit, have their coffee, have their donuts. It's amazing what this area has done. Totally amazing.
You guys?
Yeah. Okay. It's 5 p.m.
Well, it's 5:30 and I will call this meeting to order. Mary?
Recording in progress.
Mary, do we have a quorum? Yes, we do. Okay, so, Mary, if you'll lead the pledge and I will pray.
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I thank you for today. I thank you for this board and I thank you for this hospital. I thank you for your work here. I just pray that you would give us wisdom and give us insight, that you would help us to really do what's right. And I also pray that you would help us. Thank you for that. That's what we pray. Okay, do you have any visitor comments? We'll tell you thank you for letting us your wife.
They'll give her back when they're done.
Oh. Go on that. Are there any additions or changes to the agenda?
I'd like to delete the board policy needs under B3.
Can we change it to, so I was hoping to talk about in that same space, a bylaw, a time where we could get, kind of plan a time when we could attend to bylaws. Can we just put that, can we just,
She substitute that.
instead of deleting it, just put bylaws there? Sure. Okay. Or bylaws, schedule or something. Is there any other changes or additions to the agenda? Okay, so, would somebody be willing to make a motion that we accept the agenda? So Ben moved and Carrie seconded. Does that work? Okay. Oh, we should vote on that.
Yeah.
All those in favor of with keeping and with the changes, the agenda, say aye. Aye. All those opposed, say. So, guys, I just have to apologize. I am so tired. I hope I can keep my words in front of me. So, anyway, this stuff. Okay, and then the minutes. Did everyone have a chance to read the minutes? We did change, Denise changed, because it has Kathy, that she was there, so we took her off. Is there any other changes anybody else noticed? Okay, so I would entertain a motion.
I motion to approve the minutes.
Okay. Is there a second?
I'll second.
Okay, and Gary. Okay, all those in favor of approving the minutes, say aye. Aye. All those opposed, same. Okay. The minutes are approved. Okay. So now I think we're on to Tish for the finance committee report.
Did you have anything you wanted?
I don't know.
Okay, so did everybody get a chance to read the financials and are there any questions?
Do you want a copy?
I would want a copy. I looked at them on the computer.
I need 10 copies, because for
Yay.
some of you
You
may
made
have.
10? Okay.
I did,
I would love
and
to.
then you may have one
Thanks.
as well. So, basically, it's just an update on where we were from the prior month, which has kind of been the norm. There isn't anything really bad, but there's a couple of really good things that have happened. So I updated and uploaded to Sage all 22 months of the historical data. So as soon as they get them entered, we should be able to go in and start truthing out, making sure all those trial balances are correct, their balances with the audit reports that we have had. So then we're going to be testing all of our financial reports that we created, and I'm really hoping to have those in 3 weeks to where we can start, at least have an education on them. Since it's been so long since the board has actually seen financials, I would like to have an educational class, which is something that I've done with prior boards. So we can dig in, we can figure out, what is this telling you? What is that telling you? The budget has been uploaded into Sage, so the budgets and the P&Ls will have variances, actual budget. We did get our CMS price delinquency. I had a meeting with them today.
You mean transparency?
Transparency, oh yeah, our delinquency on our transparency. We were missing 4 lines that identified the hospital on our website. That's why we failed. So Wendy was able to get those up and loaded. So we should be able to pass that. That's all they were waiting for. It took 4 times to finally get that out of them. So that's done. I'm considering that done. They approved it today verbally. They will issue us a letter. Ready Health has requested, they are the ones doing our charge data master, which is the one that controls all of our fees for what we charge our patients for the services that we provide. They have requested the report come in a different format. So we reached out to Monument Health. It is a custom report. And they do not know how long it will take them to get that report. It could be up to 6 weeks for them to create that report for us. So I still am hopeful that we will be able to get our price increases done in time to go with our new budget and everything July 1st. I have reached out, talked to the auditors. We are going to be starting in 2 weeks to give them all of our audit reports. We're going to start with the trial balance, copies of the reconciliations, things like that. We're going to give them the data that they can get, because we're up against all the other companies that closed December 31st, so that they will try and get us done. The ADP payroll issues are finally resolved. We had a couple of little glitches that when we retransmitted them, some of the employees that were terminated were not built in Sage, but they were built in Meditech. And because we went back to May, the very first one, and retransmitted all of those payrolls, that has been fixed, and all the payrolls have been transmitted, and they are hitting the general ledger accurately as far as the liability and the expenses are going. Had a quick meeting with Wendy today regarding our accounts payable, where we can send it electronically. She decided that Adobe Pro was slightly better than DocuSign, so we are going to go with Adobe Pro. We are going to be installing that license on Emma's computer tomorrow, so she can start sending out all the invoices digitally for signature. We're going to send out a did you know type warning for all the department managers that if they don't sign it and get it back, they're going to get 7 reminder emails. So it's going to be irritating. So hopefully that will give them some incentive to get them returned quickly. I just finished putting in the September inventory expense, so we have gotten from February to September in and done. So all those expenses will be hitting the departments. So that's done. We'll continue to do that until we have the inventory piece up and running. What we are lagging is the pricing. We are verifying all of our item master supply charge pricing. It was not consistent, so we had variances within the Band-Aids, variances within the ACE bandages. The 2-inch one was X amount, the 3-inch one was less than the 2-inch, and it's like, okay, this doesn't make any sense. So we're working on our pricing methodology and formulary. So that's where that is. As far as SAGE goes, at the time I wrote this up, I had 5 months left, but that's all done now. So the chart of accounts has been created. I decided that I would create a general ledger flip table. So what that technically does is, let's say I've changed the general ledger number to 1, 2, 3, 4, 5. And before it was 5, 4, 6, 3, 2. If you entered in the first number, it will feed into the second number. So until we can get all the transition and everybody trained and used to the new general ledger numbers, I'm hoping that that will eliminate some mistakes, things dropping, things we can't find. So the budget was just uploaded today. The 2025 budget was uploaded, so I'm hoping that that will be good. I'm doing a final run on all of the reports, the balance sheet, the P&Ls, the department P&Ls. I have a 12-month running report. I have a detailed profit and loss report. So we have lots of different options for our reporting. So when we go to issue those financial reports, we'll be able to have a set that you'll get every month. Okay. We have the accounts receivable. We have our statistics. So the statistics will mean a lot more when we have financial data to go with them. So I'm hoping that that will be something we can at least start working on. So you can see the variances. I'm looking forward to being able to say, well, the difference between 38 days and 31 days is this much dollars, which makes it a little more, it's easier to track, and it will have more meaning for the board. So we are also getting $458,000 for our cost report. That is what we were owed. We are not spending that money because we have to submit a corrected cost report 2024, so we're gonna hold that in reserve. So in the event we actually owe that money, we'll have it, and it won't have an impact on operations. So, are there any questions?
Are you happy with the accounts receivable?
I'm not. So what we did was, I am meeting with the business office manager on a weekly basis. We are going over industry standards and where we stand and what our plan is to get them to industry standard. Typically they're called KPIs. It's an acronym. It just means in business industry standards. So for an example, it is customary for claims in the hospital to go out in 5 days. The OR in 8 days, the ED in 3 days, the clinic in 1 day. Those are industry standards. And if we have a variance, there may be a reason. Maybe it's provider's contract. We say they've got 7 days or 3 days or whatever. But we are going to start tracking those to find out how long it takes us to get a claim out the door and where the lag is, if there is one. Are we waiting on the provider's documentation? Are we waiting for coding? Are we, did we have a complete fall down of something? So we're gonna start tracking those, so that will help our efficiency, and it will allow us to get paid for the services that we provide, hopefully in the same month that we provide them, especially with like Blue Cross and Medicare. You're welcome. Sure. Thank you very much.
Very much. Yeah, that's what I was gonna say.
So, Finance Committee, we had a wonderful meeting. And first I would love to commend Tish and her team because we had actual data to discuss. And as you all just heard from Tish's report, the amount of progress that she's made this month is wonderful. We are so encouraged and excited for next month, so thank you, Tish. But we, as we told you last month, we had, the Finance Committee was focusing on 2 areas, and that was the manor and the clinic. And as far as the manor, Shane will tell you more about it in his report, but it sounds like he's really done a great job with his team of identifying some of the issues that they're having down at the manor, getting a hold of those. The census is up, and as you can see, cash from manor collections is heading in the right direction. And Shane and his team are on a great path from the manor, and we're really excited about that as well. Clinic. Kathy will tell you about her plan to hire some more providers over there. And what I had asked Kathy to dig into a little bit was utilization of the clinic to make sure that we are right sizing, that we have the right amount of providers for the business, that so when people from the community call, they don't have to wait too long. But then we also don't have providers waiting around. Yeah. And back in December, this board had approved the hiring of a clinic manager, which we, the Finance Committee, based on the preliminary figures that Kathy was able to get to us, we still feel like that is a great idea and it's going to contribute greatly to making the clinic into what all of us want to see from the clinic. We want to see a good functioning clinic that is able to get you as a person in quickly and efficiently with the right number of providers, the right number of specialists, and we think Kathy's really on the right path with that.
May I ask a question?
Yeah.
My understanding is that got put to somebody stopped the process of doing that hiring. Are we back to it now?
Yeah.
Okay, I just want to be clear. Okay, thank you.
And so that the board knows too, Ted was not able to attend the Finance Committee meeting, and so I asked Ben if he'd like to join us. So Ben joined us in Finance, and it was great to have you there, Ben.
Thank you.
And,
Nice to meet you, buddy. I appreciate it.
Yeah.
Cleared up a lot of questions I had. I didn't have to ask tonight, so that's great.
So as you know, as we discussed, the Kathy was able to provide us with some preliminary statistics and able to tie into some numbers thanks to Tish and her team. So I think the whole Finance Committee is very comfortable that both the manor and the clinic are heading on the right path and in line with what this board had decided the direction it was to go. So Nathan, do we have anything to add?
No, I agree with that assessment exactly. Shane has done a wonderful job in the manor. There were several different roadblocks that were discovered, and I want to commend Kathy again for the way she's managed the manor. Did you say we're up at
44 will be 47 next week.
47, which are numbers that we didn't think were possible a few months ago. And what I'm the most proud of is I've been asking for the organization to pursue efficiency of doing more with what we have or even less, and that has really shown up in the spending. For the third or fourth month in a row, payroll really is under control, whereas it was not before. And for the first time in a long time, it looks like our invoice spending is at a very manageable level. And that took months and months and months of hard work to make that happen. So for the first time in a long time, I think our numbers say that we've turned the corner. I think we're really headed in the right direction.
That's the bottom line on the finance committee. We are encouraged, excited, and really happy with the direction.
May I make one more observation just to add on to that? Very pleased, and again, not as part of the committee, but just to take part in it. But it was nice also to see the non-payroll expenses
Right.
starting to trend downward and
Like that was the invoices I'm
yes,
talking
absolutely.
about.
Very pleased, and again, not as part of the committee, but just to take part in it. But it was nice also to see the non-payroll expenses
Right.
starting to trend downward and
Like that was the invoices I'm
yes,
talking
absolutely.
about.
So,
I was told not to call it a trend, but we're
well, I
very
was going to say, I'm going to call it trending the right direction. Trending the right way. So yes,
Very.
very good.
Thank you, Madam Chair. That's the finance committee. Thank you. So this might not be the right place to ask it, but in the past, we had a 5 o'clock board training time and then went into our meeting at 5:30. And so what I'm wondering about is, we've been talking today about different board training stuff. And so would the half-hour time frame, like a half hour, would that be a good amount of time for you to train us on the reports when
It'd
we
give
get that?
everybody a nice basic grasp as to where things are, and we could have the ability to drill down. We could actually do like the balance sheet one time and the P&L another. All the P&Ls will be formatted the same, so once you get one, you should get them all. And then what's the difference between a balance sheet and the PL? So just so everybody's on the same page and can explain it.
So that's why I was checking whether you were thinking
Yeah.
about a whole different day or whether
No,
that would work.
I want to keep it small so your eyes don't glaze over.
So we can still put words in front of our mouths?
Yes, yes, that's it.
Okay, very good. Anything else under finances that anybody else, are we good to go, move on? Okay, so how do we want to handle this next piece, Kathy?
Okay, the board discussion and proposals. I just had some conversation with a board member about remotely working from home. And actually what I'm doing is developing a policy for that, just so that we have structure around it. We don't have a policy currently, and we need to have one so that we can regulate that in a proper and appropriate way. So I thank you for the suggestion so that we can move forward in a positive direction. And then the forensic audit, Ben, maybe you want to talk about that?
Sure. I'd like to bring a motion to the board to, in the future, commit to a forensic audit that goes back years prior to this board and this leadership. And I think it's very important for that. While I think we're doing great things and we're moving forward, I think we have to, in order to serve the public the best we can, we must take the time, take the effort to make sure there's no malfeasance prior. So I would ask that we can bring forth a motion that I don't think we should do that immediately. I don't think it's something that should take from what are the important efforts that everybody's doing. But I do think that at some point within, I don't know what even the time period should be, but sometime in the future we should at least commit that we're willing to take that steps, spend the money for that in the future.
Okay, if I may suggest something?
And I can slightly
Sure, please.
attempt to improve the motion.
Absolutely.
So there wasn't actually a motion?
Well, right, it sounds like we're working up to
We're working up to it, so
right.
please add.
And so if you'll allow. I was thinking this is a great idea, and that maybe the motion would be to ask management to put a plan in place for us at a timing that they think is best for the organization, and evaluate and select the appropriate consultants and so forth to do this task, and when the time is right, to please bring that plan to the board.
And I was gonna just suggest that we might put it into the 25-26 budget, 2026, basically, so that we actually plan for the costs that would be associated with the audit.
What would you expect that an audit that would cost?
Well, probably it could cost as much as $100,000 to $150,000.
It depends on
It depends on the company.
where you want to look.
How far back?
Yeah.
I've got to check with people first and probably get some ideas from you as far as what areas you want them to look in.
Right.
What about, like, should we put that, like, would something like that, and maybe this goes with what you're saying, go, like, when we have from thinking about the training that we just went through, would it fit in deciding where it goes on our priorities? You know, if we do go through
Or strategic plan.
a strategic plan, and you know, Melissa was saying, you know, let's pick, well, she said 10, I would prefer 4 or 5, you know, top priorities. Do we see if that makes a list, or we just talk about it when we do the budget?
I don't know if it raises at this point to be a priority. I would say that it probably, I just want to make sure that we're adding.
Keep talking about
Keep
it.
talking about it, not lose track of it. So I like Kathy's idea that we think about it. It should be a budgeted item for the next budget and be considered. So I don't think we're at racing to have to get this done. Right.
So my question would be, I'm trying to break it. What would we be looking to accomplish with the forensic audit? Because spending $100,000 to $150,000 and our finance team is actually making progress right now towards the financials that we really want to see. Going backwards over stuff that is in the past, and we'll learn minimal amounts from it. What would be the point of spending $100,000 to $150,000 on a forensic audit and taking our finance team away from moving forward?
I would give it this way, and I'll try to put it to the basic level as where I'm at. When somebody in the public comes to me with a belief that there's been malfeasance with money, I would love to be able to tell them not. And I think anytime we're going forward as a board and as an organization, if we can't make that statement, we're going to have trouble. And so and I think it's critical that we truly focus primarily on the future. But I think based on the fact that we've been 2 years without financials, just from that standpoint alone, I know I have a lot of questions. And I know a lot of the public comes to me and says, where did the money go? I don't know what money they're even talking about. But the issue would be that I think we have to close the door in order so we can truly be able to say we've done everything we've done.
Could I say?
So that's the point that you're looking at, is to kind of put a period and then to
Yes.
send.
I have a different point. I believe there's just the activities of one person that need to be looked into. You don't have to look at everything everywhere. If enormous amounts were taken, it would have been taken by a single person, and that's not a huge job to look at one person's access to the disbursement process and the check writing and so forth. The purpose for me is to try to recover large sums that would be due to us, and I don't think it would take $100,000 to do that sort of limited scope as to what did this one person do with their role, as far as we can tell? And are any large sums missing? If so, the intent would be to hand it to the appropriate authorities and attempt to recover funds that were stolen, if anywhere. I'm not saying anywhere. That is more my purpose with a motion like this, and I don't think we would have to look at what everybody did in the whole hospital over 10 years. I'm just focused on one or two. And the people who would have been in the position to override the controls of the organization and do whatever they would like with our checkbook and so forth, those are really the only people you would
Which would
want to look to.
Which definitely could be part of the planning going
Right.
forward. And I would agree.
Right.
I don't think it's every dime.
If large amounts were taken, we should see if there's a way to recover things. I'm not saying that they were, but I think it's a much more limited project.
Or if I could suggest, you guys might want to make a motion to have us evaluate and get some evaluations for you as far as companies and what
Right.
might be done. So that would be the first step rather than the whole enchilada, so to speak.
Right.
We could look at what it's going to cost to do something like that.
I would just,
Companies are doing.
Ben, I would just suggest something like, I move we ask Kathy to develop a plan to address our concerns in this area and to bring it back to us when she thinks it's an appropriate time. Yes.
So are we ready for a motion then? Or we just got more discussion?
If you make the motion in the second, then there's discussion.
That's true.
Don't worry, we've been-
We kind of been discussing.
We've been discussing.
I guess I
stuff.
sort of made the motion.
So, yeah, go ahead.
Okay, so Madam Chair, I'd like to make a motion that we ask Kathy and her management team in the timeframe to be determined to come up with a plan and evaluation for a forensic audit to occur in the future. Is that close enough?
I'll second.
Any discussion?
I just want to explain why I'm gonna vote no for this, and it's purely because for me, spending the money and taking the financial team away from the primary goal of moving forward, I just feel it's too damaging at this point. And the only upside of it is the potential that perhaps you could recover some money in a lawsuit, but I have no faith in the Justice Department, and I hate lawsuits, and all that would do is cost us lawyer fees, and I have to vote no for that reason. I just think it takes too much away from moving forward. That's just my thought.
Okay, so I have a question because we're talking about it'll cost $100,000 and an outside.
And that's a guess.
Yes, right, but then we're also talking about you're gonna put our whole financial team on it. If we're paying $100,000, do we have to another outside entity? It's also going to take our whole financial
Yes,
team?
because our whole financial team has to feed them all the information that they need to do the audit. So, and it's an enormous amount of work.
And so is it considered a forensic audit to audit the actions of a couple of people? Or
It's a very limited audit, and I think Ben's motion is just to ask management to please look at this issue for us
and
and
price
make
it?
make a recommendation, not that we're agreeing to spend any amount, but just look into it, let us know what you find out, and then at that time, we can decide if we want to move forward with that or not. And I think that's the right first step. So we're not agreeing to pay any amounts or anything like that today.
I think the positives that would come out of it is not only the potential to maybe recover funds, but also for us to be able to say, hey, we had it looked at, we've done, it's either been closed or it's been dealt with, and, that does put the period on it. That allows us to say, hey, we took it seriously, we had it looked at.
Well, and I'd like to add that if somebody stole a lot of money from this hospital, I'd like to see them prosecuted.
would be interesting hearing kind of Tish from you, what, or do you, is that putting you in a bad spot?
So what is it you'd like to, the last, I have been involved in 2 forensic audits for various and sundry reasons. Typically what happens is it's a specified, how many years are we looking at? So what they do is I would pull all the invoices. I would have to review all of the bank reconciliations. And we have 7 bank accounts, which they can be consolidated, but at the time frame, there were 7 bank accounts. They will look at all of those bank accounts, and they will tear everything apart. That's their job. Their job is to look.
We're kind of getting ahead of our skis here. I think what Ben is asking is, would you look at this issue for us and make a recommendation on how you think we should move forward, and if we should move forward, and what would that look like, and do we have the time, and so on and so forth.
Well, and I'd like to emphasize, I mean, you know, we've all talked about, we all know of the condition of what you guys have taken over. I clearly have never seen an organization run for 2 years without financials. I've clearly never seen an organization that's had these kind of falters when they've changed from an accounting system. I've clearly never seen an organization have these issues financially and survive this long. And so all of these lead me to question. And when somebody comes to me and asks that question, do you know where all the money went? My honest answer at this point is I cannot say. Again, I have full trust in this group. I think we're started the right way and we're doing great things. But that, I guess we're talking about it before, that elephant in the corner is, has there been something in the past? The COVID years especially. The COVID years are a big question in this country to begin with. And I just think we owe it to the public to be able to do this.
Right. So I think your motion is all about transparency and accountability.
Yes.
And I guess deliberations.
So one more question I would ask is, how much time does it take for you and your team to figure to do that piece?
I don't think it'll be that much time. Yeah, that I don't think, because we just would have to look for the right companies, and then we would want to define for them to work. So that's going to be something that will take a little bit of time, is defining the work, and that's probably going to take talking to the board to find out where they are.
And the input from Tish would be great of how many, I really don't know the time frame that makes the most sense. How many years to go back. So that kind of input would be great.
Well, money certainly changed a lot in 2019, 2020.
I was going to say
Right.
that's where you saw
So
the huge.
this organization's finances were very stable. I see lots of evidences of pretty decent management and pretty sound cost controls year to year to year. And then we had 1 year where one category of our costs, I think they doubled from like 4 million to 8 million. And in that period of time, that's not a reasonable event, given the things that were happening in our country. I think it was maybe 2021 or 2020, I can't recall. And so I don't think we need to go back any further than that. And our other, and people that were here for a very short time, it's a very short window to look at. So basically, the person who's at the top of the organization is the person who can override all the controls, bully everybody, do anything, cover it up, threaten people who expose them with firings and so forth. That, if anybody did it, it would be the person at the top, most likely. So I would just be thinking tentatively on a very limited engagement that wouldn't go back further than that, just to kind of answer the question of, why did we go from being a hospital that was financially stable, that we weren't losing money, to a hospital that lost money, as our auditors said, for the first time in recent memory in fiscal year 2023? Why did that happen? And so I don't think we have to go back much any further than that.
I guess my I don't know if it's a concern, but where you mention one person, I think is it a witch hunt?
It's not a witch hunt. It's just that in an organization, I don't want to single anybody out, but it's the only way to really steal a lot of money is to override all the controls that an organization has to stop someone from stealing the money. And the only person that can just override all the controls and no one informs on them or blows the whistle is everybody's boss, who can threaten firings and so forth. So if that boss is doing a good job and the controls are in place, it's hard to steal a substantial sum. So we've had massive losses in the tunes of millions. I think 2023 we lost 2.3 million, fiscal year 2023. Fiscal year 24 I'm guessing will be a loss. And so this is an attempt to explain why did a hospital that's in a stable community with a stable population, nothing really has changed, why did it go from being stable year after year after year to having these massive losses? Was it really just a sudden bout of ineptitude or something, or was it something else? And if it was something else, and millions potentially have been taken from us, then I think we have a duty to look and see if we see any signs of that activity. If we do, perhaps we can go a little further, and if we don't, perhaps we can stop. But we're kind of getting into the weeds.
I was just gonna say, the truth of it is it will either clear somebody as well or not. So it's not really a witch hunt. It either clears someone or it finds something to seriously be looked at. That would be criminal.
As the point guard, as a team leader, what do you do personally? What do you do to help your team get to the level that I know you guys all want to be at, and I know your fans want to see at?
Yeah. I'm not going to stop, preparing and working hard when we're not in practice. I'm going to continue to get in the gym. But as a leader and a teammate, right now, we're coming off a losing streak, and we are the desperate team. We need to figure it out and find a way to win these close games, because I feel like with all the top teams that we've played to our competition, whether it's up or down, and we just haven't been winning these close games. I feel like, over time, we can't keep losing these close games. We got to start to figure out the small one-possession mistakes or the small late-game mistakes that are losing us these games in a close situation. And, I feel like we just have to understand that it's the Mountain West and we can't come out flat versus anybody.
So it's not really a witch hunt. It either clears someone or it finds something to seriously be looked at. That would be criminal.
I just want to make clear, I'm speaking purely hypothetically. I'm not trying to disparage or slander anybody. I'm not making any accusations. Anybody's done anything.
Well, and I'll add to it, from my standpoint, I don't even know their names. So I couldn't witch on anybody because I don't know their names.
So, is there are we supposed to be audited every year?
Yeah.
But auditors, so let me explain that process.
So
auditors tell you that they make Tish and Kathy sign a management representation letter. Okay? And it says, if you lie to us, hide things from us, etc., 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 our audit will not detect that. An audit that gives the auditors a way out, because auditors rely on management telling them the truth, no one hiding things, because hypothetically, if a CFO, not anyone here, if a CFO and a CEO and everybody in the organization wants to collude to hide things from the auditors make the management sign a piece of paper that says, you're agreeing to tell us the truth and not hide things from us, and if you commit fraud, we have a way out as the auditors. And so they tell you up front, our audit is based on everyone telling us the truth and giving us documents and these things not being in place, the audit is not designed to detect fraud. That's a whole nother thing, and that's what we're talking about, is an engagement, agreed upon procedure to look specifically for that behavior.
So the auditor would not conduct the forensic audit? It would be a different company?
It could be an auditor, but it wouldn't be an audit. It would be called an agreed upon procedure, where we would define the parameters and say, we're interested in going back this far, looking at the spending and disbursement activities of the people who were at the top of the organization when our losses started, to see if you can determine if there was any theft of funds through improper disbursements.
Okay.
Does anybody have anything else they want to say? So with this, I want assurances that, so this, and maybe I might be going past where the motion is, but I would hate to see us spend money on this, but not spend money on some other things that we need, like the IT stuff, or some of these things.
This isn't a motion.
I know, so that's why I
That's
say
It's
just
just a motion
just to find
just
out.
to say, please look at this for us, give us your recommendation, let us know what you think we should do, and so on and so forth. And bring it back to us when you feel it's an appropriate time.
Okay, so somebody restate that motion, and
I'll
then
state
we'll
it,
go
no
on
problem.
it.
So, asking Kathy and her management team to plan a time frame, plan a process, evaluation of conducting a forensic audit in the future.
I second the motion.
Sorry.
I had already said it.
Oh, sorry.
That was just
I was just
restating
rereading
it.
it, and I didn't state
Yeah.
it the same way exactly.
Yeah.
That was basically it.
Okay, and, can we add just one little tiny bit to it?
Sure.
Which would include how much, an analysis on how much time it will take away from our employees
Sure. Yeah, absolutely, part of the plan.
as part of the,
Right.
yeah,
And the time and cost.
yeah. Okay, so all those in favor, say aye.
Aye.
All those opposed, say nay. Okay, so that motion is passed. Okay, Kevin, you're up next.
Okay. On the community health needs assessment, it really just came flying through my email, so what I'll do is mail it out to you all, and then we can use it as part of our strategic talks going forward. Does that work for you guys?
A different one than the one we got a few months ago.
Yeah, it's put together in a nicer package, much more easy to understand, and it's basically the one that we would approve for the state to have knowledge of, so.
So when do we need to approve that then?
Well, if I bring it, I'll send it out to you all, and then we can, at the next meeting, worry about that.
You were supposed to do bylaws discussion in there too.
Yes, oh yes, thank you. So what I thought, I think that Nathan is right. We need to have a bylaws discussion and work through it. And so the question is, I also think that we need, that each of us needs at least a month to look at them and figure out what we think, and then come together and talk about it. So the question that I have is, do we want to try to do that in a meeting? Do we want to try to, right, in our next, bring our changes and then vote on them, and then, like, so say, bring things that do we want to work through that in a meeting, say, next month? Or in our regular meeting, and then vote on it in the next regular meeting? Or do we want to have
had some thought on this. So I don't see a need to duplicate efforts. And so, Ted was wanting to be careful, which I thought was appropriate. But we don't need to duplicate efforts. We have Allison, who probably drafted our bylaws, who's our attorney. So what I think would be a good starting place is just pick a topic that we want to address. Like, what should the chair be able to do, or any other topic that we want. And just meet as a group and discuss and say, do the bylaws reflect our values or someone else's values? And if we don't think they match our values and they're not having the appropriate governance and so forth that we want in the organization, then we could just, if we can agree on the change we want, then we could just have a motion to ask Allison to please draft what change she thinks is appropriate to affect that change in our bylaws, and then bring it back to us in the next meeting for our review and approval if we can agree on it. So I think that may streamline the process.
So I'm thinking maybe we should take a chunk of it at a time.
Yeah.
Say we're gonna work on whatever,
Yeah.
this section, this time, and not, I don't think that we can probably do it all at one time.
Yeah, I think if we did, we would have to schedule a full afternoon or something like
Yeah.
that.
And I think it would be best to just start page 1 and just pick a manageable part, and everybody can read that manageable part. And if we are all happy with it, then great. And if not, then we can have that discussion. And if we can just agree in concept on, Allison, it's doing this, it doesn't match our values, we'd like it to do that. Could you please draft the change you think would be appropriate to affect what we want? And then we could approve that if we could all agree at the next meeting.
Could we make it an agenda item every meeting just to discuss these sections?
But as long as we come prepared, you know what I mean? So this is the portion of the bylaws we're going to discuss, and so let's come prepared. You want to say something?
Yeah, so a point of information, it's 16 pages long, divided into 8 sections. So,
It's gonna take a while.
yeah, and I only have a year left in my term.
You eat an elephant one bite at a time.
Exactly.
Yeah.
Because I'm a deliberative thinker, I like to take ideas and think on them and then act. I would just ask that if we were to do it like that you could let us know in advance, like next board meeting, we're gonna tackle articles 1, 2, and 3, bring all your ideas. Everybody brings their ideas, we have a month to think about it, and then we vote on a change in the next meeting. So at least we have some, I just don't wanna come and hear a suggestion for the first time and have to vote on it on that meeting. I just feel like that doesn't give me enough time to think. Does
I
that
agree
make
with
sense?
that. I do agree with that. I would like the time to be able to sit with it, think of what everybody's points were. Yep.
Yeah, do some research.
So
And,
how much?
if that's the idea, then I think that's great.
Maybe for the first
How
time,
about
we would just take the first
You just do the first 2 pages.
page.
There's not that much on the.
Yeah, the first page, there's
Yeah.
only one thing at the bottom that Gary and
So-
I both would like to change. It's very confusing wording in section 2.
Yeah, so maybe the
And
first 2 pages.
so I think the first 2 pages,
So the
excluding
second
the administrative
page-
part.
Yeah, the second page
Yeah.
runs into.
I know.
There would be like half
So
of our
if we
go-to.
exclude the administrator section, which goes to page 3 and then page 4, then the first page, I think the only change that anyone has expressed interest in is in this paragraph where the wording is very unclear about right here. I think you and I have talked about it.
Yeah, so what if we did it as an experiment the first time and took page 1, so that would be Article 1 and
Okay,
Article
sounds good.
2, Section 1, 2, 3, 4,
Yeah.
which would bring us down
Yeah,
to
page
the
2. Yeah.
Yep.
So,
So Article 1 and Article 2, 1 through 4.
all of Article 1, Article 2, sections
Yeah.
1 through 4.
Allison, can I ask you a question? Can you hear me?
She might have to.
Yeah, I can hear you.
Oh, okay, sorry, I just want to make sure. We've had some trouble with the speakers.
I can hear you.
I just want to check and make, are we legally sound if we want to send emails to each other as boards about our thoughts?
Can you hear me?
Yeah, we can hear you.
I may have muted you. Can you hear me, Allison?
Can you hear me?
Yes,
we hear
we
you.
can hear you. Can you hear us now?
No, she muted.
Yes, I can hear you.
Okay, thanks.
Okay.
Is it lawfully sound, given all the open meeting rules that we need that are important that we need to comply with? Can the board read these bylaws we've identified, and if we have ideas, share them with each other via email in between meetings, or is this something we need to restrict our discussions with in open meetings?
So I don't have the statute in front of me, but there is a statute that says that sequential communications, the effect of which is to debate a topic, result in a meeting which should be held in the public. And so that's not black and white, unfortunately, but that's what the law states. So my recommendation would be either that you address these topics in public meeting or that you defer them to a committee. And it's up to you all of how you decide to handle that.
Okay, thank you, Allison. So,
Sure.
I think I'm happy just to read what we've identified, and I think if we can reach an agreement, we'll probably reach it fairly quickly, at least in concept. And then we can just ask Allison to, please make the appropriate changes.
But if we do it in the format that we were talking about, then in the next meeting, everyone would bring all their thoughts and suggested changes to these two particular articles. We would discuss it together, come to a final resolution, and then wait to vote on it for another month.
I'm more focused
So-
on the meaning and less on the, where we take things out and add things. So I'm going to come prepared to say, I think this paragraph is saying this, and I'd rather it say that. Can we agree on that? And if we can agree on that, then we can ask Allison to say, Allison, we've agreed, we want the bylaws to say this rather than that. Can you please make what changes you think are appropriate and present them to us the next time for our review and approval? And that's a little less in the weeds.
So, I feel like it would be, I would rather ask Allison how to change it the second month. Like, I would rather us discuss what we want to do and then, so in a sense, spend 2 months on each section. Does that make sense?
What if we happen to all agree in our first meeting?
Right, yeah, that's true.
But there is one provision in the bylaws, though, I think it does have to happen your way. It says if we want to actually make changes to the bylaws, it has to be in the agenda. So I think because of that, we actually do have to do it the way you're proposing. So we would have to see if we could agree in concept, then we'd have to have it on the agenda for the next meeting, and only then.
So, and also what I'm worrying about is we do as a board, and I'm talking about me, I mean, I'm saying we, but we do go back and think and have second thoughts.
Sure.
And I feel like bylaws are important enough that I don't want to have the discussion like, oh yeah, that's right, and then go, oh my man, what was I thinking?
Right. But we would have, so if we could somehow agree in concept in our first meeting, and then ask Allison, please draft whatever change you think is appropriate for our next meeting, then we could put it on the agenda. We would all have that month to think about what we agreed on, and if anybody changes their mind, then we could bring it up at the next meeting.
And have another
Or-
month to think about
Yeah,
it.
right, well,
Right.
because
So-
we would have to either accept whatever she wrote, and maybe
Right.
we say, oh, we don't think that's exactly right, and so, yeah, potentially, it goes
So
for
what
another
we-
month.
what we-
but-
It might be what we should do is limit our time, but that would be a place to limit our time. That's
I
our
guess the bottom
bylaws.
line on the process we're discussing is that we're going to take it slowly and deliberately and
For sure.
give ourselves time to think on it. And because bylaws are so important, we're not gonna make any
Right.
quick
Right.
decisions.
Right.
And I think
We can
that's a
see
fair
how this
process.
goes this first time with this
Right.
chunk,
Yeah.
and then see, knowing that we're not gonna vote on anything in that
Right.
one,
Right.
but we're gonna have the discussion and whatever, and then if we,
Right. Yeah, just because we do it this way this time doesn't mean that we.
Right, we
can-
might be able to go
we can-
faster or slower on other parts depending.
So, since I'm never good at homework, somebody please repeat what we need to go on.
Article
Just so I have
one.
it.
Okay, Article
And do you have a
one.
copy?
Do you have a copy of the bylaw?
No, I'm not with
Okay,
them.
so this is what we'll do, Article 1, which is on this first page, and, Article 1's there, Article 2 as far as here.
Okay,
So,
I'll pull up I've got a copy. I just
Okay.
didn't bring it.
And make sure, I think the most recent bylaws are dated
2023.
Yeah.
January 19th, 2023. So just,
where are they dated? I'm not sure what one's.
well, the very last page is notarized.
Oh, it's,
Yes, sir.
2023, yeah.
So,
I got it.
okay.
There was a question about the email stuff, and first of all, this is me speaking, but very careful with that, okay?
Right.
I want to, we've got copies of 16-4-405, open meeting laws. Anybody that needs them, I will bring them next month if you want.
Yeah.
And it's 2 pages. It's really not that complex or lengthy to get through, but they're very, I guess there's a couple gray areas in there, but not that gray.
Yeah. So I think.
So anybody who needs that, please let me know. I will make sure you got copies of that
And
next
just so
month.
you know, I think we decided that one of our strategic priorities is to do some very serious open meeting law training to really
That would be good.
so we all feel like we're very comfortable and we know what we're
And
doing.
then in that vein of thought, Bob Bonner's really good with the open meeting laws. He would be a good one to pull in and give you some training on that. He understands them very well. Do you want some of those next month?
Sure.
Sure.
How many
I would-
do you
I would
need?
love to. Well, I'll take one.
Yeah, just,
Yeah.
why don't you just make one for the whole board?
So that's how many?
7.
7? You
Yeah.
got it.
I
Thank you.
have mine.
8, because currently in 2
They'll be laminated.
Oh, you're so good to me. That's good, I'll just carry
So
it
do you
around
want
with me in the meetings.
Do you want a motion, or are we just?
I don't think we need a motion for
Right. And
this.
so
I
we're
Just
coming
putting it
at
on the-
5
Put it on the
o'clock.
agenda.
Are we coming at 5? No, next week.
Wait and see.
Will we do this as part of our?
This will be part of the meeting.
Okay.
That's why I was wanting to.
Right.
So, but that is in the, I did bring that, because that is what we used to do on the board prior, is we had 5 o'clock training, so, but
Okay.
we have to figure people out, and anyway, okay, let's just hold off on that for a little bit. Okay.
Physician recruitment.
I knew I had it.
There's Dr. McCarty that I think I've mentioned to you guys already once before. Did the analysis for the clinic. We definitely have room for a couple more providers and be able to afford them. So we have Dr. McCarty and Dr. Leonard. Dr. Leonard is female. She wouldn't be ready for a year. I just found this out last night. For about a year yet, because she's doing some extra studies. She's family practice, but she also does pain management through interventional stuff. So it would be whether or not we wanted to plan to have somebody that could do some of that interventional stuff like epidurals and that sort of thing that's got plenty of cases to be able to do that. So that's for future conversation. I will forward you all of her information so that you can all look at that and see about her credentials and everything. I will forward you all of her information so that you can all look at that and see about her credentials and everything. Dr. Hageley's been helping me talk to both candidates. Dr. McCarty said that the week of 3/11 to 3/15 he could come to visit. That's during a spring break for some of his kids that are in college and stuff. And so I wanted to see if you guys could look at that. Usually what I do with a board is we either have like a lunch or a dinner with them, and you guys get to speak to them and learn more about them and that kind of thing. So how would you like to let me know about that? If I send you an email and then will you guys try to look that up? But I'd really try to, if we could try to find and define it, lunch, dinner, preference, or whatever you guys want to do. And if you want your spouses to come, that would be fine too. Okay?
So would it be helpful for, I mean, I can see everybody's got their calendars out.
You're free?
So good, March
Okay.
11th.
Oh,
You're talking about the days, March 11th, 12th, and 13th?
Mm-hmm. And 14th.
Oh, 14th.
Through the 15th,
Okay,
yeah.
through the 15th. I can do it Thursday night
Okay.
or Friday night. All parents are conferences.
Okay. Anybody else?
I'm tentatively open all.
Okay.
I'm gone the weekend of the 15th, but prior to that,
Okay.
actually,
Okay.
I might be able to come later in the week, but Brad's having his other knee done the 11th, so
Oh, okay.
it's maybe.
Okay, so later in the week. So what if I try to do it a little bit later in the week but avoid Thursday PM? Well, everybody doesn't have to come, but if we could do Thursday at lunch, maybe that would be the one to do it. Nighttime is kind of nice because it's dinner, but,
I can't do Thursday.
oh. Are you gonna be gone Thursday, Friday then?
Actually, I'm free on that Friday. I'm gone the 15th. So that's
So
Saturday.
Friday night,
Friday would be the most hopeful for me too.
Friday. What about for you with your,
It's doubtful, but I will try to make it work somehow.
okay, well, I'll see if I can come up with something
Just for
genius.
Friday night. This Friday
I could
morning.
probably hop in for a little while on a Friday.
The good news about both of them is one's from Gillette, Dr. Leonard's from Gillette. Dr. McCarty worked in Gillette at one point at his own clinic, and now he's looking to be closer to his kids, so there's connections to the community. They're permanent, which is also very nice. Not maybe permanent, but they're definitely wanting permanent jobs. The next thing is that's a conference that I got with grant money from the state. So we're going to be having that for the managers and, well, basically anybody that's a leader on April 30th for a day class, just so you know about it. And then I have Charlotte here. She's going to show you some things she's been doing. We're starting to do a slow walk because we have so much to do to get our finances and things in order. But we're slowly walking into being much more proactive on how we're going to market ourselves going forward. So there's two different things that she's been working on that I wanted her to show you, and then she'll tell you a little bit about some of the goals that she has. So Charlotte, with that.
Hi, I'm going to come up to the table so I can show you one of the fun things I've been working on. But while the niece gets that up, I just wanted to tell you guys about a few events that I got coming up. So we have a 2025 Wellness and Vendor event. It's going to be March 22nd at the Senior Center. And then we have HR will be doing a careers and trade fair March 12th at the high school, Newcastle High School. We also have an in-house CNA class happening March 10th through the 21st. And then we'll be also participating in the Upton Festival of Tables March 15th. So other happenings is Ponderosa Hills has been here this week to be doing a virtual tour of the manor. Quite excited about this. This will help provide a valuable experience for families. as a resource for care decision, whether bringing their loved ones somewhere.
Can you tell them a little more about what that is?
What's Ponderosa Hills?
Ponderosa Hills Production is a company here in Newcastle, and they do filming of things. So they'll be doing a virtual tour, which in case is just literally what it is. It's a walkthrough tour of the manor. So somebody from, let's say, Arizona is wanting to put their loved ones here in Newcastle, they can see what our facility looks like and see if it's supposed to fit for them.
It's Dan and Melissa Langto.
Yep.
You guys know who they are.
Who?
Dan and Melissa Langto.
So you like post that on our website?
Yeah, or if you contact Shane, he can send the link of the video so they don't have to come travel, and it gives them an idea of where they're putting their loved ones. Because right now, if you were to Google Weston County Manor on Google, it's just a picture of our outside of our facility, so it doesn't really give you much information.
We had discussed, there had been discussions, I know from the board and even from leadership, about having an open house where we could let people come in and kind of do those tours. But, as we met and discussed it, we thought maybe it was not the best idea to bring outside people, especially with all the influenzas and all this kind of stuff, so that if there are brothers putting grandma or mom in, and one does live somewhere else.
We had actually, when we were discussing this, we had 2 referrals where the children actually lived out of state and nothing about the facility, couldn't make it up here. How do we get them to see what we got going on? So this would be open to all referrals for them. If they're wherever, they can jump online, see what we have, and give them a lot better idea. Because time constraints once in a while for people make it very hard, especially if they have a lot going on when they're trying to juggle this better idea of what they're walking into.
It will really showcase the manor.
And so did they just post this on a website that they have and you can link to it, or how does this work?
On our website.
Oh, they're gonna do it for our website.
Yep.
I think it's a brilliant idea. I think that Charlotte's done a really good job of getting that stuff taken care of as far as going there. We spent a couple of days doing different things. In fact, we have some pictures with the residents playing bingo and things like that. So I think it's going to be something we'll be really proud of. And she's done great work with it.
Yeah, we got a few residents' testimonials as well today, so that will be filtered into the video as well. It'll be a good investment because we can use this for many, many years. It's exciting. It's fun. Yeah. Yep.
When will the video be available to watch?
They told me yesterday that they're looking to give me a little demo of it, potentially in 2 weeks. And then from there, Shane and I and whoever else can look through it and give us.
So maybe next meeting.
Yeah, for sure. Most likely. Yep. Yeah. So that's one of the fun things. The other thing is we partnered with Zaid Graphics to design a friendlier and more modern website that provides a better user experience. So this is kind of what it looks like. It's still in the production state. Yeah, so you can see that it's a little more inviting and fun. So we'll start here. I'm just going to click on a few things so you guys can kind of check it out.
Who is Zaid Graphics?
Yeah. Zaid Graphics is also a local company. It's Zaid Osborne. Partnered with, yeah. He's done lots of websites for around the community.
He's been doing some workshops through the Chamber of Commerce as well.
I personally think it's good for us to partner with local people when we can. So they also have very nice local prices.
Yes. So very nice. So you guys can see here's the providers. We have their names. Did we spell?
Let me see. Yeah, that's right.
Oh, yeah.
Yep.
There's educational stuff throughout.
It's hard to go over there, isn't it? Because can you put that minimized somehow?
Just go over on this side. And I got this in the way too. Oh, I don't know why I go on that side. Oh, sorry guys. Here we have our benefits page. It gives, if somebody is looking to apply here, it gives a little detail of benefits and it's updated. You guys on there as well. Check that out.
We are going to have some new pictures and photos for those that want another picture.
And then you can download the agenda and
Yeah, their agendas will be linked to those areas. A little easier to see.
the minutes as well.
The cost of this is actually less than what we are currently paying for just the hosting of our the design. And then once we go to just yearly maintenance, it's like a third of what we've been paying for what we have now.
There's some fun patient education as well, so if you want to know about an annual checkup, you can click on it, you can pull up something else, and let's say you want to do a physical exam, pull up and just give a little detail about it. Some things.
Our price transparency and cost calculators are in there.
It's got our price transparency and calculators, and it also has a place for you to go so that you can pay your bill.
There'll be Epic, Epic Access. They'll also, we're going to try to work on getting you the ability to be able to schedule appointments with providers directly through here as well.
But I can't say enough that this is a new thing that Charlotte's doing, and she's very talented at it. She's doing a great job, and so she's getting stuff started and really getting into the community, and we appreciate it very much. Did you want to tell me some other stuff, I think?
Yeah, so just a few of my goals while doing this would definitely be to increase social media traffic. And Kim and I have launched the Daisy and Petal award. We would like to get that more into the public eye. Increase staff recognition and be working with Kathy on culture changing. So a lot of exciting things. Yeah. Thank you guys.
Thank you. Thank you.
Is that, Charlotte, is that new website up now? It's not. Oh, it's not live.
We'll let you know when it goes live.
Cool.
It's close.
Did we want to discuss the logo part?
Well, down the road, what I'd like to be able for us to do as we get closer to having all of the things we need in place, like our financials and that, I'd like us to talk about our mission, vision, and values types of statements, make sure that we may want to refresh those and our focus, and then perhaps even rebrand ourselves a little bit, which may mean a logo update that's more modern, for lack of a better way to say it. But it's sort of a way for the community to be able to start to see the changes that are happening from where we've been to where we're going. So that's our thoughts around it. It's not going to happen overnight. This is stuff that we have to do over time. But we really are looking at trying to build in the community that we are headed in a better direction and a good direction, and that we are looking for their partnership with that. So that's part of the work that we're starting to do. And so the culture shift, that's going to be relative to the Dare to Lead, and then there's some things we're doing. You guys had the RACI class today. Our managers are working on teams to come up with some ideas for things that we could do in the different pillars that I have for them, which is people growth, people finance growth, people, community, and quality. Yes, so quality lady, you better tell me that. So those are our focus areas that we're going to have from an internal perspective, and then we can see how those prioritize what strategies you all have. But
Could you repeat that? I have people, growth,
finance, quality, and community. We are working on culture shifts, so I just want to make you aware of that, because sometimes when you change the culture a little bit, you have pockets of resistance. We have pockets of resistance right now. And it's a good thing, it just doesn't feel good. So we're in the storming phase. We kind of had the little bit of the honeymoon stage, but now we're trying to implement some rules and structure and expectations that are very foreign to some of them. So some of it's just a learning curve, and others of it is that they've gotten away with some kind of behavior that perhaps they just can't have anymore. So you may hear an uptick on that just because you may.
It's the nature of the beast.
It's the nature of the beast, but I wanted you to know that we're doing it for the right reasons and trying to align people with where we're headed. So, I think that was the end of my stuff for today.
So, you're up, Kim. All right. And you've got your big old stack of promotion there. We've got Dr. Akers, who's clinic welcome, Trey Blanchard, clinic welcome, Dr. David White, Dr. Leo Flynn, Dr. Charles White, and Dr. Jenna Fujimoto. They're all from different radiology and radiologists. And then Emmett McElhaney, he's from Blackhouse Orthopedics.
Is Dr. Blanchard just to get it finished for her until, because she's no longer working, so, actively.
So,
So yeah, I'll just click them after. So then going into next step, Shanae from physical therapy came and talked about the concussion head injury forms. She notified the providers that there's this form that they can fill out for concussions that they can turn into the state, and the state will actually reimburse or pay for that. She notified the providers that there's this form that they can fill out for concussions that they can turn into the state, and the state will actually reimburse or pay for that visit for the concussion. So that'll kind of help parents if they can't afford the clinic visit to help get their kids in and make sure that they don't have like a big brain injury kind of thing going on. So pharmacy, Suzanne said that she updated our TNK's order, which is like a blood clotter eater buster thing. For stroke, the stroke dosing is different than for cardiac, heart attack dosing. So she made a little kit and put it in the Omnicell so that there's no confusion on which dose to give, stroke versus heart attack. And then she's going to be working on pulmonary embolism as well.
What was that, Matt?
TNK's.
TNKASE, yeah. That, we did have an event from that medication where there was a wrong dose given. So that's why we changed our processes very quickly on that. Nothing adverse, thank heavens, nothing bad happened as a
Good learning
result of it,
experience,
but it was definitely a learning opportunity.
So we did some epic reconstruction. We took the problem out and fixed it all so that it can't happen again. And then Tara, the PRN pharmacist, came and talked about some type of psychotropic medication updates that's going to happen in the manor. So essentially, all residents that are on psychotropic medications, they need to have a valid reason of why they're on those medicines. And if there's not a valid reason, on our next survey we can be tagged for that. It can be a pretty big deal. They can see it. They can take us for abuse as like a chemical restraint, so they're turning it into a really big deal. So we just need to make sure that we've got our documentation in place. Part of the nice thing is we do use volunteer psychiatry, and they round on the residents that are needed, and so they provide a lot of our documentation for some of the psychotropic medicines. So that's kind of maybe a lot of that. And then Suzanne did say that the Baxter company in North Carolina, they got hit with that hurricane back, whenever the hurricane hit. They're about at an 80% production capacity, so they're kind of on their way back. But she did ask the staff that we still be mindful of oxygen, IV, normal
normal saline. And she did say that we were a little bit low on our normal saline with the 20 milliequivalents of potassium in it. So she did put what's called a potassium rider. Basically, you just add it to normal saline and you just mix it and then you can give it to the patient that way. So we can still treat our patients with potassium deficiencies. Keisha's going to be working on a radiology menu of services. And that'll kind of help with the website too, just so that we educate the providers on all of the services that our radiology department can perform. Just letting them know that we can do MRIs, we can do CTs, we can do specific ultrasounds, all of that. She's also going to be with that adding CPT codes for the clinic providers, anybody that does a prior authorization, just so that that number is there, easy, accessible, so they don't have to look through this big book and figure out what CPT code they need for the authorization. Just kind of streamlining that process a little bit, you know. She also said that our MRI truck is getting an upgrade, so that'll be nice. She's not sure if they're getting a patient experience added on to it, where you kind of think she's going to put like glasses on and it shows you like a seascape or whatever kind of scape you want for people that have anxiety. And she said that they also completed the first scoliosis stitching with the new x-ray machine, and she said it looks beautiful, so good things with that. Nursing home report at the time the census was 41, and I'm sure she will update you in a little bit on more of that. And then we did get our 3rd star for the 5-star career.
We got a what? I didn't hear that.
Our 3rd star on our 5-star like care compare, it just tells us how we compare to other nursing homes. And you can look at any nursing home in the nation.
Is that the one we were at 2?
Yeah.
Now we're at 3.
Yeah,
One of
we were
these.
even at 1. Yeah, we were at 1 at one point just because of data.
The listings just came out, what, like 2 days ago?
Yeah.
Home health, at the time Heather said they had a census of 27. She was seeing an increase in patient refusals because of the high copay from Advantage plans, so she was going to work and try to figure out a sliding scale fee so that we can still get those patients in and see.
Sliding scale.
Home health.
Oh, home health. Yeah, for people if their income matches that, then I think that we might be able to have people be in our program and not have to get out of it if we can kind of cut down some of their copay amount because they basically fit the criteria to be able to do that.
Another great reason not to take the Medicare.
Yes, exactly. Yeah.
Let's see here. On the acute care side, Denalda had 3 skilled swing beds, 1 observation, 1 acute patient. That's obviously changed since then. But she currently has 2 travel CNAs and 1 travel RN. With this current CNA class that we're holding, one of them doesn't really go to the acute care, so hopefully we can knock one of those travelers off. We talked about provider-to-provider education. Just a gentle reminder that if anybody from the clinic sends a patient over to the ER, that the provider calls and gives them some report on what's going on with the patient. And then just clinic-ordered CT. Having some issues with prior authorization with insurances, and so working on getting that process a little bit more streamlined. And that's all I've got for med staff. So on quality, we met yesterday. On our ED wait times, we did see an increase in our times this last month, and a lot of that was to do with Monument Health being on divert. We did have a few episodes of trying to get transportation in, but the majority of it was Monument Health capacity. The acute care, we've got a new wristband printer on order. Thank you to Corrine for that.
It's been delivered.
It's been delivered.
Thank you to the foundation, really.
Yes.
I just took it to them and they said, sure.
So we'll get that now implemented and we'll start printing wristbands for the ER and get them on our ER patients.
And could you just, for the benefit of anybody who's watching, briefly explain how that's going to help the patient experience?
For wristbands?
Yeah.
So it's going to increase patient safety, making sure that the right wristband is on the right patient. So when they go to scan, if they give any meds, that it's not the wrong patient. You know, if you've had an allergy in the chart and they give you the wrong medicine, you know, we don't want to have you have an anaphylactic reaction or any reaction to medicine. And then also in imaging, if you've got a contrast allergy, just making sure that everything matches up while they're here within the facility. On the Manor side, Lisa's working on AR days, specifically Medicaid pending residents, and I'm sure James can talk about this more. We're seeing an improvement in behaviors, which is reflected by a decrease in charted behaviors. And then Cheyenne is back from maternity leave, so we're going to start tracking the activities attendance again. Her goal is to have more resident attendance at the 3 major activities throughout the day. And then falls with major injuries, those should fall off. 4 of them should be coming off this next month off of our report. So our report, our CASPER report, I believe is what it is, our percentage will be looking better on that as well.
Yes.
Heather is working on schedule change notifications. So she continues to monitor her schedule changes, and then during her calendar audit that she's doing, 96% of her calendars have been appropriately updated. She had 291 calls since November. A lot of them in December were just cancellations due to the holidays and others. So I think that'll be getting better as we move past the holiday season. HR, JT said that they're still accepting job descriptions. They're seeing an uptick in completion. And then they're going to be working on updating the holiday code of conduct, exempt versus non-exempt policies. And then the grievance policy was also updated. Tish and Sandy are busy working in the business department. The AR days were just up 2.5 days, and so Sandy's going to start coming to quality and kind of give a report on what exactly specifically they're doing to help with those AR days, and they're working with us.
And Tish, could, just for people who are watching, so don't want to put you on the spot, but a lot of people, if they're watching, will have no idea what we're talking about with AR days.
Oh, about the accounts.
Can you explain kind of what that is and why it's important?
Yes. So there is a set of numbers that we watch, which have to do with our accounts receivable. So basically what that does is it allows us to measure by payer how many days in our accounts receivable are sitting in there. So right now, on average, we will have like 55 days. We're working on getting that broken down by payer so we can meet our industry standards as well. Like, as an example, Medicare days, you shouldn't have more than, they should be at 22. That's the industry standard for your Medicare day count. So it's just a form of measurement as to how well we're managing our accounts receivable. So how fast we get the claims out, how fast we get paid for our services. Doesn't have anything to do with patient satisfaction, but they always prefer getting bills quicker rather than later. What took you so long to get them rolled over? So we're hoping that that will kind of close that gap a little bit as well.
So it sounds like it's the time it takes for us to send somebody a bill and then get paid.
Right.
And I think it does, it has an impact on customer service.
I've had
Absolutely.
people tell me that it's taken in the past, like somebody will come in and it will be months and months before they get their bill. So I think that does have a lot to do with our patient experience.
And we do need to be able to notify and talk to our patients about that. It's like, yes, it took us 5 days. It took your insurance 45 days to pay the claim. So we can kind of lay out a timeline for them so they understand what it takes to get paid through their insurance.
And are we current? I don't know. If somebody comes in and they want to get their bill electronically, do we do that, or are we just going to?
Right now we do them paper. I haven't had time, I apologize, I haven't had time to do much digging in with Monument and Epic. Right now, we're trying to get our bills out consistently through Monument. That kind of seemed like that needed to be the first starting point.
Okay.
We would like them to be sent to us electronically so we can run an audit on them to make sure that they're being billed appropriately before we print them out and mail them out. So that's kind of where that project is now.
On the HIM side of things, there is currently 37 chart deficiencies, which is a reduction of 180 since last month. So that's really good. So Kelsey's going to be working on a weekly report that's sent to Kathy, Sandy, and myself. And then she's also working with Epic to neck down the time frame in which a chart becomes deficient. We placed a ticket yesterday to turn it into 72 hours to really cut that time down so that she can stay more ahead of the game there. Lab, Jim said that his reports are mostly completed with Monument Health, which is a good thing. So he's going to be looking at other performance measures to work on. Probably we can analyze or coming in. Implementation of that, making sure that goes smoothly. Same thing for Keisha. She's just going to be working on the CT machine implementation. And then Polly, she brought a nice little report, and what I'd like to do is have her manager start giving me like a statistical report that I can bundle and give to you guys, so you guys actually have something to look at for a qualitative report, not just hearing me chat all night. So she gave a nice little report that 75% of the facility received flu vaccinations, and I can have her email me that handout and I can disperse it to you guys so you can see the breakdown of each department of the percentage of and then Charlotte talked about what she's been
It
doing.
made me very proud that she had a chart.
She was very.
I was very proud of her.
It was very great.
Oh, yes.
Tammy's working on trauma. She's been working on making sure that the staff are documenting patient temperatures, heights, and weights when they come in as a trauma. There is a cot in trauma 1 that records the weight, so she said that that's been helpful on the weight portion. And she's still working with staff to make sure that the time of injury gets documented. Sometimes that's still being missed. And then the biggest thing that she's working on is making sure the patients get transferred out in less than 2 hours. She said they're making that 3-hour mark, but not all of them are making that 2-hour mark. So she'd like to see that down to 2 hours. And then kind of the facility focus. We're down to, well, we were up actually, up to 1,100 hours, and a lot of that's due to dietary and PT. They had a PT gal out and dietary as well. And then the other thing that we talked about is we created a patient experience committee recently where we are going over our survey results. We could spend a whole quality meeting going over the survey results, so we decided to kind of cut that out into a separate patient experience committee. And we had our first meeting last week, and I think it went really well. We're going to be talking about wait times, updating patients on wait times, which should probably decrease in the next month. And then also our survey return rate. We had a 14% current return rate, and we'd like to see that at about 20 by the third quarter. So we'll see how that goes. So just we'll kind of get a grasp on.
I was gonna say something about that too, because I don't know, how are we supposed to be doing like our clinic surveys? What is the process for a patient getting a survey?
So anytime they're seen, as long as their mobile or email is in their Epic chart, it'll automatically send them a survey as soon as they check out. I believe it's the next day they check out. We should get a feature.
Okay, so when I saw a provider in the clinic recently, I did not get one. Before, when I like seeing someone there, I did get one like that, and then I did not get one a couple of weeks ago, so I don't know if we've got a little
But
bit.
basically put a parameter on it that you only get one every so many
Yeah, I don't know if there's something
Yeah,
like
because
that.
I got one right away from a visit, and so I do think that there is a parameter that's built on there that if you are back very quickly, or I don't know if you were, but if you were back after so many
It was a
times,
few months,
we don't,
but
well then it should be.
I want to say typically it's a 90-day
window so that you're not constantly getting inundated with these
Sure.
surveys. But let me double check it.
I was just curious about that, yeah.
Thanks for asking.
So, it's not on the agenda, but we should have had you give us a brief foundation. Did you guys have a foundation meeting?
We have a foundation, yes, we had last month's one, which might take me a minute to think through. Because
I'm
I don't-
sorry.
Ah.
So it might be you've already given it.
And then we have one next week, see, so, well, I don't,
So, because I
I
remember
think
you
we're-
talking about wanting to do that. So you must have had a meeting. for
we
that.
did, yep, we had a meeting,
While I was gone,
yes.
it was
So
around the
it's probably
28th.
right
And
after our
let's
last board
see.
meeting, I bet.
Okay, that's January's foundation. Was it January? Yeah, that would be it, right?
Yeah. that would be-
Okay, so I do have the stuff, see? Okay. Tish was actually, she came and introduced herself to the foundation, so that was nice. Keisha came in and talked to them all about the whole CT machine and project and whatever, and the foundation was definitely on board with just supporting all of us in whatever way that we're gonna handle that. Extra funding. I requested them to consider the wristband printer, which they then immediately approved, and I went and got the check and brought it back that day. They are gonna have a daddy-daughter dance is back on and that's Charlene Kimmer probably working with, did you guys ever find the decorations, or we still haven't found them? Okay, we still have to maybe look into that a little more, but anyway, that's kind of something that had been put on hold in the past, but they're gonna look at going ahead and doing that as a kind of a community outreach thing in the fall. They are wondering about a little bit of representation from Upton for the foundation board. So thought maybe if you had suggestions or something, they would just mention that to me. Our next meeting is the 26th, and yeah, Keisha's gonna have a town hall. She reported that she's gonna have a town hall on the CT machine in about April to explain that to the community. We just discussed that in foundation board too. So, and we discussed some fundraiser ideas potentially. So that was great. That was good job. I'm like, oh, I have that. It was a good meeting.
Okay, now on to JT.
First off, I'm going to talk about dietary, but there are desserts up there. I'm not sure if anybody saw that.
Did not.
So please avail yourself of the desserts. First off, I have submitted my reports and will be to SharePoint.
I noticed it.
It's there. And I will be doing some more metrics. I know that Kathy's talked to me about getting some turnover rates and getting some other things. Another thing, a good thing about the social media stuff and the marketing stuff is that we want to also be able to, so our social media is going to point to our website so that we can better track traffic and so that we can see where people are looking at, what they're looking at, and if we look at Facebook, we'll be able to get metrics about ages, married, male, female, where they're coming from, and I think that's a big part of seeing what's happening. And we're also going to work with Ponderosa Productions to do some ads for social media that kind of catch our special little niche here of the outdoors, the monuments, and the Black Hills, because we can be, I think it's important that we are intentionally trying to find people who have skills, whether they be physicians or physical therapists or radiologists, or rad techs and stuff, that maybe our area really would speak to. And those campaigns will help us with that. On talking about desserts, dietary, we do have our new dietary manager, Melissa Hammer. She's already, this is her second week. She's really doing good. I sat with her yesterday. We had a staff meeting for dietary. I'm really excited. We're addressing some issues that have come up out of resident council. We're addressing some concerns as far as I think that with the problems that we had by going from 10 to 4 employees 2 months ago, we had to cut off employee meals. We had to reduce the choices of the residents from 2 to 1, and we probably faltered some in our presentation and our quality as far as meals are concerned. So we are getting those back. Starting the next week, employee meals will start back Monday, Tuesday, Wednesday. We're working on some grab-and-go options, which will give our weekends and our night shifts the opportunity to also pick sandwiches up out of the cooler and some different things. So we're really excited about that. We put out an all-user, Cheryl actually did, or Kim did, a Google Doc trying to find out what do our employees want. We've got the results and we've been looking through and sifting through that. Melissa has. We did that, right, Kim?
In addition to the weekly printed version of the newsletter journal, we also promote our community and share important information on our award-winning website, newslj.com, and in our weekly email newsletter, Nuke Now. We also connect with readers through various social media platforms and invite you to check us out on Facebook, Twitter, and Instagram. You can even take a look at a recent meeting of the City Council, School Board, or County Commission on our YouTube channel. We do hope that you will go to newslj.com and subscribe today, and we look forward to making all of our great content available to you. But regardless of your level of support, we thank you from the bottom of our hearts for doing your part to preserve a free and independent local press.
Put out an all-user, Cheryl actually did, or Kim did, a Google Doc trying to find out what do our employees want. We've got the results and we've been looking through and sifting through that. Melissa has. We did that, right, Kim? And so we're really excited. I think we've got the mouthpiece of our employees, and we're going to make sure that we take care of our assets. You know, our employees are, you know, our greatest assets, really. So we're looking after them, and I think that we're excited. When I put my document in the SharePoint, I said we had one opening. We did have one voluntarily resign, but within a day we had the job filled for the final cook position. So that position, after putting notes in, will start in about 7 to 10 days, and dietary will be completely staffed. And we are super excited, especially since last month when we met. You know, we really weren't sure what we were going to do, and some of us were a little tired from what we were trying to do to help them and assist them. So I want to thank our dietary staff that stayed, that have been really helpful, and I want to maybe make a mention to those who are new and to our new manager. We're really excited. A part of Melissa's agreement, she's going to Dakota, has been doing the CDM training, and she will be done. I understand she's got about 4 more courses or projects, so then she'll be done. Melissa, a part of her agreement, she's also going to be required to get it finished within a 1-year time period. So that will help us as far as making sure that we're on track as far as the dietary part and the dietitian part for our residents. So I'm excited about that. So that's all good news. I really just have good news. We are looking into our health benefits. Nathan had sent in some information, and we were able to work on some really good information. Thankfully, we're actually able to get some good information. Thank God for Tish, you know, because up until then, other than guessing and trying to, you know, do the best we can, we've not really had that great of data. So we're getting data slowly coming in, and so we're working on our benefits. One of the things that we're working on is looking at our company. Right now we're utilizing Gallagher for our healthcare broker kind of a thing. But I found that they are slow to respond, if they respond at all. I mean, I've gone weeks waiting for responses. And there's been some delays and some difficulties with enrollments, so that they're not really supporting us that well. So we're looking at some other options, and we will. I had some preliminary calls, and so I'm going to be getting some information back. But and I know it's ahead of time, but in HR, we're always ahead of time looking at open enrollment, even though it just happened. It feels like. But we will be looking at our numbers very closely, and I'll be presenting. But we're also going to look at, we're right now a self-funded, but we're going to look at a fully funded option as well. I think we might be better served with that option. So I couldn't really do anything last year. By the time most of us got here, we had 2 weeks or so to make a decision. So this year, I think.
Big survey.
Correct.
Being able to do that with all your employees.
Correct. So this year, I think we will be able to really look through our options and make sure that we are streamlined. So we do have more participants in our health insurance than we did last year at the open enrollment time. So our numbers will as we go up in those who are part of the program, it spreads out the cost among more people, which also helps the costs go down for the organization and for the employees. So I'm excited about that. So we are evaluating the market, and we're looking at all the options. The other thing, and kind of one of the latter things, is our retirement plan. We have had some hiccups with our retirement plan. It's through Nationwide, and it's also through with Pronghorn. We're having a similar issue that we are with Gallagher, with just getting responses. It's really slow. It's, everything is really self-service, so we're paying for a service that we're really not getting anything from. I think our retirement benefits need looked at anyways, because we kind of have an antiquated situation going on. So that's something that we will talk about later. But we're not even having they're not even coming quarterly to discuss to us about plan improvements. I mean, I'm used to looking and saying, okay, these are not performing, we want to switch out, whether it's target dates and different things, and that's not happening. We're just not seeing anything like that. They're not hardly responding, much less seeing anything like that. So we are looking at a couple of organizations to help us if we decide to move from Pronghorn and Nationwide, which I think my recommendation is that we should, and I think we would be better served. So I have talked to Tish and Kathy. They've given me some names. If you have somebody that you have experience with, I'm more than welcome. I'm more than happy to have those conversations. But I'm used to having my retirement and my, there's a name of a company that we're looking at in the notes, and I can get you more information about them. They do all of it, even 401ks. It could be a one-stop shop. I've normally had retirement funds broken out, but I am used to having my points of contacts with, whether it's health benefits or retirement, texting me and answering my phone calls. Right. So I think we can definitely be better served with that, because right now I don't even know how we're performing as far as our portfolio is concerned.
Wasn't there a lady that came and did a presentation to the board once, like a couple years ago?
There's a lady that came to sign people up if they wanted to, but there's, as far as coming from the side of giving us their performance and the portfolio stuff, that's not happening.
It's not.
And I don't quite get it, because there's a fiduciary responsibility on their part to be able to do that. The other thing I'm going to mention, but we don't have any data to support ourselves on it, but I personally think that our people being able to buy into retirement and having to be vested for 5 years is very old-fashioned. And we really need to modernize that, because people do not like, and I'm one of them, I do not like a program that has a 5-year vesting requirement. So I'd really like us to modernize that. And that's
because we're accruing for it already.
Yeah.
Can I Steve. So for the benefit of the employees, I've looked at a lot of different retirement plans. I used to audit retirement plans. And the thing that makes the biggest difference to people over time is the fee that the custodial, and some of them are like egregious. If you're paying 1.5%, if you look at the math and how it's exponential, it costs you an enormous amount. And if it's a S&P 500 index fund, they're not doing anything. They're just stealing your money. A computer can run an index fund. And so I would think for our users, that would be an important point of consideration.
It would be. I'm used to having a quarterly, I'm actually used to having them come in quarterly, discussing, going over some real high, not just high level, but in-depth reports that then we pass on to the board quarterly so that they can see, what's happening.
I mean, we're a big enough organization that we should be able to have at least one fund available to employees with no fee.
Well, with pretty minimal, we don't need to get too far into details, but usually at the time you want to engage their services, if they're coming in as the low bid, then they tend to make it up off the employees at these sort of exorbitant fees. And it's sort of a despicable thing to do, but it happens all the time.
We will be watching out for that, and we will give presentations. I'm sure wherever we go or whatever we look at, they'll come in and we'll be able to spend some time with them. So I'm happy about that. We're also going to work with connecting and doing carrier feeds. That's another area where we have where manual work on our side can lead to errors. So for a minimal fee, we can actually link carrier feeds from ADP or UKG or wherever we end up, and we're getting close to finalizing this and closing the book on this stuff. Once that's done, we will get carrier feeds initiated so that they will be able to pull that data. It will be, the employee will put it in. It won't be a little mistake from HR. Oh, we're sorry, we screwed you up. This will be triple check, double check. The employees will put their information in, and then that information will not need to be put on a spreadsheet and then uploaded. It will just go regularly, and that eliminates errors. That also will help us when we determine which way we're going with the payroll errors, because where we're facing the most errors is in that manual entry between the time clock and then the payroll system, because we pay for a service to flow, and they're not doing it, so that manual personal error is catching us. We got better. Seems like every time.
Well, but it's inevitable.
Yeah.
Because it's just mind-numbing work. And the most attentive person, after so many manual entries, it's just so busy.
It's a spreadsheet that you have to manually enter to that's updated, and there's still manual features on the other side when it's not necessary. They can be really automated, user-friendly.
So improved controls and payroll.
Correct. And so folks that haven't seen it don't know what we're dealing with. We're dealing with multiple contracts and multiple different. So we have a spreadsheet that goes in, okay, if it's the third week of the month and the sun sets in the sky and this happens, then this happens. Well, a lot of the schedules, because I don't work with the department schedules, sometimes I don't know. And if the manager doesn't do their part and doesn't check, we look through there, we look for, oddities or some places where there may be, that doesn't look right. We do that, even down to what was it, $1,800 this last time we were trying to, looks off. We can do those kind of things when we audit and when we review, but to know that somebody worked a special pickup shift where they were supposed to get a $3 premium, if the manager doesn't input that, we got 100 emails through the 2-week period. I forgot to clock out, and I forgot to clock in, and I forgot to. So we're trying to do that. So the process when we get there, that's a big, long explanation to talk about carrier feeds. We'll automate this. I'm gonna hush. will automate this process, will help us control the errors, because the errors aren't just there. The errors are nationwide, they're in all these areas, because we're paying for a service that we're not utilizing, and we need to. And so I believe that we will get, I'm not saying we'll be error-free, but we're hoping and praying to be pretty darn close.
At that point, it is end user error.
Correct.
And not administrative error.
The nut on the wheel.
Right. So it sounds like the potential for an efficiency improvement in terms of labor hours.
Yes.
It will happen. So that's great.
Yes.
Okay, so let's go ahead and move to Shane on the manor.
Okay.
It's your change.
Okay, so January's average census was 42. We had 3 admissions in January, 2 discharges. So current census is 44 as of today. Tomorrow will be 45, 2 more coming in next week, and we're working another 6 or 7 on that. So numbers are moving over there. So we've started adjusting staff some, so I appreciate them being open to some of this. So we are trying to move some stuff, try some different things to make sure we got some better coverage in certain areas. So with that kind of leads into our 5-star. Kim talked about it a little bit. So CMS ranks all nursing homes. 5 stars is the highest ranking you can get. There's 3 categories with it: health inspections, quality measures, and your staffing levels. So we are currently a 3-star on health inspection. We're 2 stars on quality measures, but like Kim said, one of our biggest things that's taking us down right now is falls with major injuries. That should actually go to 0 here in the next month or so, so I think that star will definitely go up. Staffing, we picked up 2 stars this last quarter, and that we were 1 star, so that improved there. So
How long is the lag time between when we make substantial real improvements and when that gets reflected?
staffing is, so we submit, it takes them 3 months from what we submit, but we're submitting stuff that's 6 months old, so basically 9 months on that. Quality measures, some of the stuff stays on quality measures for almost a year, so you could have something on there that you've addressed, but it's still there. So a lot of that with the quality measures, we've implemented some stuff, so we're trying to jump ahead of it, so start addressing it. And health inspections, they have to go quarterly, so every other state survey, so it's on there. And then your health inspections actually capture your last 3 years, so your most recent one weighs the most, and then the older it is, the least weight it has. So yeah, staffing wise, Dr. Haberly just started as our medical director, so yeah, QA with him last week went really well. Dr. Akers has started rounding, so staff is speaking highly of both of them, so good change there. Casey Bergstrom has stepped down as social services director. This week was her last week, but Bree Terry has taken over, so she's got a lot ahead of her to learn, but I think it's a good opportunity for us to start addressing some of the things we're discovering as we're going through this. So yeah, that's a quick one. We'll kind of jump in the Medicaid pending, just how that works, because I know that's a big opportunity for us. So, and I guess maybe I'll just go from the beginning with Medicaid, just kind of explain how that works, because I know there's that rumor out there when you go Medicaid, the state takes all your stuff. That's one of the biggest rumors. That's not how it really works. I tell everybody how Medicaid works. It's the government's just trying to figure out what you can afford. If I'm loaning you money or if I'm paying something, I want to know what you have to pay. That's all the government's doing. So there's a process when you go to do it of knowing the government wants to see what you can afford, and that's what you'll end up paying. So going through that process, we have to work with the state. They'll request stuff. The state has been very short-staffed lately. They are full-staffed as of 2 weeks ago, but there's going to be a learning curve with all the state people. We've already ran into this, that some of the people that have been hired just don't understand, so there's been some denials where we're going, this shouldn't be denied, so we're going back having those discussions to make sure, hey, this is actually how it works, working through that. So then the other part with it, Medicaid figures out how much you can pay, so say you have your social security, all that stuff comes to us, the resident gets $50 out of that. So we're making some changes with that, where we'll pay you, or social security comes directly to the nursing home. So we collect, and then we can distribute the residents' money. So one of the things we will change with our admission process with Bree and Lisa is we're going to get in front of that. We can kind of figure out, one, if they're pending, is it good pending, but we can also figure out, hey, this is about how much you should pay. We can start getting that money up front. So those are some of the things we're looking at of changing, and hopefully get our Medicaid pending down. And the lag time with Medicaid pending of us getting paid can be up to 6 months, which is very hard to carry. So we're trying to get that taken care of. So.
I have a quick question on the new website. If somebody wants to learn about, so we're working on the manor, that's great. If somebody wants to know what providers we have at the clinic and information about the clinic, is that going to have information on there?
It's already kind of all set up already, and then we're also working on being able to click the picture, get the
You can see the
information,
providers.
and then be able to schedule an appointment right through there.
I think it tells a little story about them, right, basically. Yeah, we have a little story about them, so that that's in there.
And I have an idea. There's something, every time I drive, I look at the clinic, and I was like, if I'm at the hospital, I wish I could see part of the building.
Oh, because of the trees?
Right. So I don't know if we could like trim them just a tad or something, just so it's not like, I don't know. That's just me.
Yeah, no, I agree, they're kind of bushy.
It's kind of hidden back there.
It is.
So back on the manor, how does it work? How do the self-pays pay?
So they actually do pre-bill for the month, so they pay a month ahead of time. We'll send out a bill.
And there's no way to not, like, people are not paying, right? Like in the manor, how does that all work?
So where we run into that is where you get into the Medicaid pending ones, where, yeah. So that's probably one of the hard parts when you have somebody who's private pay and then all of a sudden runs out of money and then goes to Medicaid. You got that pending part in there. So that's something we can do a better job on admissions, trying to get a better understanding of that. Kind of monitor.
We've had some patients that have been brought here because of APS type stuff, where they're in situations where it's dangerous for them. They qualify for Medicaid, so we've taken them because there's not a safe place for them to be, and then we have to wait for the Medicaid to come tickle in. But nobody stays for free at our facility. Nobody stays for free.
That's what I was wanting to
Yeah,
clarify.
nope, nobody does. Yeah.
Is there any other questions for Shane? Seems like everybody's been very thorough, so thank you. Is there anything else that we need to talk about?
No.
Thank you to all of you. It's clear how hard you all been working. That's all.
They're a good bunch of people.
So anyway, I've completely lost track of how we move from here to there.
We'll make a motion to go into executive
There we
session.
go, okay. Do we want to move into executive session right now, or do we want to go take a, now that's why I can't remember, because Ted always tells me what to do. Ted, you tell me.
We take a couple minutes.
So how do we do
Calls it a
that?
bio break.
Yes, exactly, yeah.
Just make a motion to go into executive session after a 2.5 hour break.
Oh, no, it's not a 2.5 hour.
So, and typically we go into executive session, so people don't just have to hang around until we all come back and then go into executive. Do you have a preference for how we do it?
I'm leaving. but I have to wait for your
That's a good
motion.
idea. So if, make a motion that we'll come into, we'll take a brief break and come back into executive session in 5 minutes. 5 minutes sound good for everybody?
Sure.
We did a formal motion.
Right, so who, so
I'll
you
do
do
it.
it? Okay.
I move that in 5 minutes from now, at 8:41, that, 7:41, sorry, that we will enter executive session under Wyoming statute 16445A2 to consider the appointment, employment, right to practice, or dismissal of a public officer, professional person, or employee. And 9, to consider or receive information classified as confidential by law, including attorney-client privileged communications, quality information, and trade secrets.
I second.
Okay, all those in favor say aye.
Aye.
All those opposed, the same. Okay. We will be back in 5 minutes.